How's it different? Well, in a major IVF center that is really trying to get people pregnant at the moment, we have constant supervision by not only by the regulating authorities like CAP and CDC and SART and FDA and CLIA. It's not only that we're very highly regulated and supervised, but we also have accountability to patients. I mean, if they don't get pregnant, we know that right away, and and they know that we failed them, and so we're going to do everything we can to have the absolute best quality air quality, best quality laboratory, most highly trained, most perfected technicians and embryologists and physicians. But if you have one of these here today, gone tomorrow egg clinics, that you're not going to know that they didn't do a good job until 20 years later. And they don't care because 5 years later, they will have sold to someone else for a profit. And whoever bought them 5 years later is going to sell 5 years after that for a profit. And then you don't know who's going to have your eggs or where they're going to be when you really need them. So I don't think they can be anywhere near as meticulous about this as a proper IVF clinic that answers every day to accountability to patients to see if their techniques are adequate and working properly. So our quality control is going to be much, much, much better. And we make sure not to charge so much. You can't afford it now. Now, possibly when you're 40 years old, you'll be able to afford IVF, and you will pay for a frozen egg cycle. And so that's when the clinic can properly get the payment for what they're doing. But to gouge you now is just purely a private capital type of get-rich-quick scheme, which I don't recommend.